The larynx extends from the laryngeal inlet into the inferior border of the cricoid cartilage. It lies opposite to the third to sixth cervical vertebra, being a little higher in women than in men. The infantile larynx is smaller than that of the adult. It is more funnel-shaped. Its narrowest part is at the junction of the subglutic larynx with the trachea. The larynx starts higher up under the tongue in early life, but with aging it assumes an increasingly lower position in the neck. The larynx is divided anatomically into the supragluteus, gluteus, and the subgluteus by the false and true chords. The supragluteus consists of the epiglottis and the arepiglotic folds and the arytenoids. Its lower border is the arepiglotic fold. Its lower border, is the ventricular band, or called false chords, which form the upper border of the glottis. The glottis include the vocal cords and the anterior commissure and the posterior commissure. The junction between the glottis and the subglottis has defined as at the level of the vocal fold or 5 to 10 mm below. The subglottis become the trachea at the lower border of the cricoid cartilage. As this picture, this is the epiglottis, this is the vocal cords, these are the vestibular, and this is the trachea. As we see, this is the epiglottis, this is the vestibular folds, this is the vocal cords, this is the supragluteus, and this is the gluteus, and this is the subgluteus, and then trachea at the lower border of the cricoid cartilage. The framework of the larynx consists of the hyoid bone and a number of cartilages connected by ligaments, membranes, and intrinsic and extrinsic muscles. It is lined with a mucous membrane that is continuous above with the pharynx and below with the trachea. The hyoid bone. The hyoid bone is a U-shaped bone which provides the upper attachment for many of the extrinsic muscles of the larynx and suspends the larynx in the neck. It consists of body, greater cornu, and lesser cornu. This is the body, this is the lesser cornu, and this is the greater cornu, and its position above the larynx. Thyroid cartilage. This is the mean cartilage. This is the mean cartilage of the larynx. It is composed of two lamina which are fused in the midline. These two lamina which is fused in the midline anteriorly, giving rise to the laryngeal prominence or Adam's apple. The angle of the fusion is about 90 in men and 120 in women. The posterior border of the lamina is prolonged above and below to form the superior and inferior cornu. It is articulate inferiorly with the cricoid cartilage. This is the cricoid cartilage, and it is articulate inferiorly with the cricoid cartilage. Cricoid cartilage. The cricoid cartilage is the only complete cartilaginous ring. This is the cricoid cartilage. It has a lamina posteriorly. This is the lamina. It has the lamina posteriorly. The lamina has sloping shoulders on which the articular facet for the arytenoids are found. These are the articular facet for arytenoid here, and this is for the thyroid cartilage. A vertical ridge in the midline of the lamina gives attachment to the longitudinal muscles of the esophagus posteriorly in the lamina posteriorly, and produce a shallow concavity on each side for the origin of the posterior cricoarytenoid muscle. The arytenoid cartilage. This is the arytenoid cartilage's three-sided pyramids. The vocal process attached to the vocal fold. This is the vocal process, and this is muscular process, and this is apex. The vocal process attached to the vocal fold and lateral projection. The muscular process to which are attached the posterior cricoarytenoid and lateral cricoarytenoid muscles. The medial surface are covered with a mucous membrane and form a lateral boundary of the posterior glottis. The posterior surface is covered by the transverse arytenoid muscles. We will see it later. The base articulate, as you see, articulate with upper border of the cricoid lamina. Upper border of the cricoid lamina. This is the arytenoid, this is the muscular process, and this is the apex. We have two small cartilages are the corniculate and the cuneiform cartilages. The corniculate cartilages are two small conical nodules of elastic fibrocartilage which articulate apices of the arytenoid cartilage. They are suited in the posterior part of the aryepiglottic folds, while the cuneiform cartilages are two small elongated flakes of fibroelastic cartilage, one in each margin of the aryepiglottic folds. Now we talk about the epiglottis. This is the epiglottis. It is a thin leaf-like sheet of elastic fibrocartilage which is projected upwards behind the tongue and the body of the hyoid bone. It is attached inferiorly to the thyroid cartilage just below the thyroid notch in the midline. This is the epiglottis, and this is another picture of epiglottis. Ligaments and membranes of the larynx. We have extrinsic ligaments. The extrinsic ligaments of the larynx connecting the laryngeal cartilages to the hyoid above and the trachea below. We have two: thyrohyoid membrane between the upper border of the thyroid cartilage and the hyoid. The membrane is pierced by the internal branch of the superior laryngeal nerve and by the superior laryngeal vessel. The second is the cricotracheal ligament, unites the lower border of the cricoid with the first tracheal ring. And this is the thyrohyoid membrane, and this is the cricotracheal membrane. Intrinsic ligament. In the intrinsic ligaments of the larynx, they are connecting the laryngeal cartilages together. This fibroelastic membrane, which lies beneath the mucous membrane of the larynx, forming an internal framework. The fibroelastic membrane is divided into an upper and lower part by the laryngeal ventricle. The upper part called the quadrilateral membrane. This is the quadrilateral membrane, which is the upper part, and the lower part is the thicker called the conus elasticus. Muscles of the larynx. We have extrinsic and intrinsic muscles. The intrinsic are the most important. The extrinsic, which is called infra and suprahyoid muscles of the larynx, attach the larynx to the neighboring structures and maintain the position of the larynx in the neck. The intrinsic muscles are all paired and move the cartilages in the larynx and regulate the mechanical properties of the larynx. They control the position and shape of the vocal cords. Abductors of the vocal cord. Abductors. There is only one muscle which is abduct the vocal cord, called the posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle. The adductors of the vocal cord include the lateral cricoarytenoid muscle. This is the lateral cricoarytenoid muscle, intra-arytenoid, external portion of the thyroarytenoid. These are adductors, mean closing the vocal cords. The cricothyroid muscle is a tensor, mean tensor of the vocal cord. So the tensors of the vocal cord are the cricothyroid and the lateral portion of the thyroarytenoid muscle. The laryngeal ventricle is a recess between the true and false vocal cord. This is the ventricle. From the anterior part of the ventricle, the saccule of the larynx ascends between the vestibular ligaments and the inner surface of the thyroid cartilage. The vestibular folds are two thick folds of the mucous membrane, each enclosing a narrow band of fibrous tissue. the vestibular ligament, which is the lower border of the upper quadrilateral membrane. The vocal folds extending from the middle of the angle of the thyroid cartilage, here, and underlying them is the upper border of the conus elasticus. Each fold is a layered structure. We have the following layers: a superficial layer of non-keratinizing stratified squamous epithelium. The second layer is the lamina propria, and this has three distinct layers: the superficial rhinky space containing fibrous substances, the intermediate layer containing elastic fibers, the deep layer of collagen fibers. The intermediate and deep layers make up the vocal ligaments. The vocalis muscle, which forms the main body of the vocal fold, lies lateral and deep. The length of the vocal fold is 2.5 cm in the male and 1.6 cm in females. The mucous membrane of the larynx. In the upper part of the supraglottis and the vocal folds are covered with non-keratinizing stratified squamous epithelium. The remainder of the larynx is lined by pseudo-stratified ciliated columnar respiratory epithelium. The vocal fold does not have any glands. We have another section. It's called the spaces within the larynx. We have two spaces, a pre-epiglottic space and the paraglottic space. The pre-epiglottic space, this is the pre-epiglottic space, is bounded anteriorly by the thyrohyoid ligament and the hyoid bone, and posteriorly by the epiglottis. Superiorly, the hyoepiglottic ligaments connecting the epiglottis to the hyoid bone. The pre-epiglottic space is continuous laterally with the paraglottic space. The second space, which is called the paraglottic space, is bounded laterally by the thyroid cartilage, medially by the conus elasticus and quadrangular membrane, and posteriorly by the pyriform fossa and mucosa. It encompasses the laryngeal ventricles and nerve supply of the larynx. The motor and sensory nerves of the larynx are derived from the vagus by way of its superior and recurrent laryngeal nerves. The superior laryngeal nerve divides into small external branch and a large internal branch. The external branch provides the motor supply to the cricothyroid muscle only, while the internal branch supplying the mucous membrane above the level of the vocal cords. The right recurrent laryngeal nerve crosses the right subclavian artery and loops under the artery ascending in the tracheoesophageal groove to reach the larynx. On the left, the nerve crosses the aortic arch. It then passes under the arch and the ligamentum arteriosum to reaching the tracheoesophageal groove. In the neck, both nerves follow the same course. It then divides into motor supply all intrinsic muscles of the larynx except the cricothyroid, and sensory branches supplies the laryngeal mucosa below the level of the vocal cord. About laryngeal vessel, the arterial supply of the larynx is derived from the laryngeal branches of the superior and inferior thyroid arteries, while the venous drainage into the internal jugular and the brachiocephalic vein. Lymphatic drainage of the larynx is separated into the upper and lower drainage groups by the vocal folds. The larynx above the vocal fold is drained into the upper deep cervical lymph node, while the larynx below the vocal fold is drained to the lower deep cervical chain, often through the prelaryngeal and pretracheal lymph node. The vocal folds has no lymphatics. Now we take a few notes about the trachea. The trachea is a cartilaginous and membranous tube about 11 cm in length, which extends from the lower border of the cricoid cartilage to the carina, where the trachea bifurcates into the left and right mean bronchi at the level of T5 posteriorly and the manibrio-sternal angle anteriorly. The trachea moves upward during swallowing, and down and forward during inspiration. The trachea lies in the midline in the neck and deviates slightly to the right in the chest to reach the bifurcation. The trachea is a D shape in cross-section with incomplete cartilaginous ring anteriorly and laterally and a straight mucous membrane posteriorly. In children, the bifurcation is higher until the age of 10 to 12 years. The lining of the trachea and the bronchi is pseudostratified ciliated columnar epithelium with numerous goblets. The trachea is innervated by the recurrent laryngeal nerve. The trachea is supplied by the superior and inferior thyroid arteries. The thoracic part of the trachea is supplied by the bronchial arteries. The tracheal veins drain into the thyroid venous plexus. Trachea drain into the pretracheal and paratracheal group of node.